You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, how to prevent type 2 diabetes. With us, we have an expert on the topic. She is an endocrinologist. She works with Scripps. She is the vice president of their diabetes program, Dr. Athena. Dr. Athena, welcome to the program.
Thank you. Very good to be here.
Now, I guess your real name is Dr. Philis-Tsimikas.
That it is, but all my patients call me Dr. Athena.
So you are the vice president of diabetes services at Scripps. I think I said it wrong at the beginning. Is that correct?
That is correct.
And what is your role there?
You know, at Scripps we have a large number of services. We have both in-hospital and outpatient services. It covers a broad spectrum across all of San Diego County, 5 hospitals and about 20 to 25 outpatient clinics. And in all those environments, someone has diabetes. Many people have diabetes. And we help develop, create the programs that help better manage people with diabetes.
Okay, good. Now, why is it such an important health topic today?
You know, diabetes is huge. We know right now that 25 million people approximately in the United States have diabetes. We know that by the year 2030, probably 50% of our population will have diabetes or pre-diabetes, at risk for developing diabetes. So it's a huge topic, issue, and we spend in the last year $245 billion on care for diabetes.
Now, you've been an endocrinologist kind of focusing on diabetes for quite some time?
20 years.
20 years. And so more and more people, are the people getting younger and younger, older and older, a mix of both?
So
they're getting type 2?
Actually, it's a great question. It's a mix of both. Our population is aging, and as people age, they develop diabetes more frequently. But we are also seeing diabetes develop in the younger age population, which is really frightening, actually.
Like at what age are you starting to see type 2?
So I have a mother that's 36 years old that came in with her son that was 18 that had been recently diagnosed, and she had another child there that was 8 years old. And she said, my child's been having symptoms. Can you test him? And we tested him right there, and he also had diabetes.
And how do you test? What is the test?
The easiest test is just checking the blood sugar. It's a little finger stick. You poke your finger, you get a drop of blood, and you put it on a test strip, and you can see what the value is. If the value is high, that tells you...
And what is high? So, for example, I'm at the Apple store, and I see something that tests blood sugar right there. What's the number?
Right.
I guess a fasting number in the morning.
Fasting number over 126 is what we use, but if it's random, any time of day, if it's over 200, that's a diagnosis of diabetes.
Interesting, and it's that simple.
It's that simple.
To detect. Now, why is it such a health problem, as you see it?
Well, there's probably a few different issues there. There's a genetic side of this. If you happen to be born with the genes that make you predisposed to diabetes, you're at higher risk. But there's a lot of health factors that are occurring in our society today that are driving increasing the risk. Increasing weight is probably the highest. Being exposed to lots of foods that
so there are
put us
triggers.
At risk.
There are triggers.
Absolutely triggers.
And so what are the main triggers?
I would say that increasing consumption of calories, food, is probably the main reason, and our growing girth is another reason. Lack of exercise, a lot of the traditional lifestyle pieces that we talk about, and it's very hard to make those changes when you are surrounded by great food, large quantities of food, and not enough places to go out and exercise.
So is it about food? I mean, look, over the last 20 years, I mean, we're just eating differently than we were 20 years, that much differently? Do you think it's a combination of lack of activity and eating differently?
Yes, it's definitely the combination, and we see the trajectory from about early 90s just going straight up. And that's where it's occurring with our younger age population as well as our older population.
Okay, go. So what steps do you do at Scripps in your own practice to prevent it, or to maybe delay the onset, or to try to keep people at low risk for type 2 diabetes or developing it?
Right. So probably the underlying strategy that we have really is awareness and education. So if someone doesn't know that they're at risk, they might not take measures to prevent it. So following up regularly with your physician and checking your blood sugars, having them check your blood sugars on a very regular basis. If you happen to be from a family at risk, either your mother, father had a history, grandfather, whatever, those are the folks that we want to check more often. But then also more broad-based education. You know, teach people how you should be eating, what you should be eating, and encourage them to take the steps required. Awareness. A big campaign at Scripps that the executives just started is wearing a Fitbit, if you've heard of that before.
What is a Fitbit?
So a Fitbit is an accelerometer, and it counts how many steps you take and how many stairs you take, and then it communicates it wirelessly to our computer.
Nice.
Not only shares it with me, so I know, but it actually shares it with my colleagues, so so that everybody knows. So there's a little bit of pressure too to say, oh, I haven't done as much activity as I could.
And what are you recommending they do, by the way? Okay, so they're on your program. They've got the Fitbit, which they have accountability. You're going to know what they're doing. And what's the recommendation?
So this is some of what we tell all our patients, some of the education we provide our patients. Park at the back of the parking lot instead of the front, take some extra steps in.
Okay.
If you're sitting at a computer all day, which we know increases insulin resistance, which puts you at risk for diabetes, get up and take a walk every, couple of hours. 10 minutes is all you might need to decrease that insulin resistance.
And why does the walking help? By the way, is it because you're burning a little bit of sugar? I mean, what is it? Is it the activity? Is there a simple way to answer this question? Why?
There probably isn't one simple way, but it is what you're talking about. You are burning a little bit of calories. You are increasing the level of activity, which then decreases that insulin resistance rather than just sitting. And they've done formal studies which look at this when you just sit. And it also takes your mind off of other things. When you're sitting in front of a computer, most people want to eat at the same time.
Good point.
So
you're in charge of the diabetes program. Do you find it challenging to spend the time or have enough time to spend with patients to talk about this lifestyle thing, about eating better, getting exercise?
Absolutely.
And you have health coaches? I mean, how do you have the time to do it?
So that is exactly what the problem is within a physician's office. A physician doesn't have enough time and probably isn't the main focus of what a physician has been trained to do.
Okay.
A physician knows how to manage medications and can certainly do that when needed. But the longer topic of how do you change your lifestyle, your behaviors, really does belong with a health coach.
And you have those there?
And we do have those there. And we train peer educators. So people that have diabetes themselves or at risk, we train them on a special curriculum, and then we ask them to go out and work side by side with our teams to help do that education.
Okay, now what about medications? Where do they fit in?
So medication, can be used. It was used in a very large trial that was done, the diabetes prevention program. It did not do as well as lifestyle management. So it's an option if someone can't do lifestyle management and physicians use it. But if we could use maybe both or tell people the information about one or the other and allow them to select, that might be the best way to use medication.
Okay, what about alternative therapies? I mean, you read a lot in the news about cinnamon, things like that. Now I'm asking an endocrinologist, what are your thoughts on this?
Right, so those are always interesting and they might begin to give us a clue on mechanisms. But would I tell my patients to go out and take cinnamon as the way to prevent their diabetes? The answer is no. That's not going to do the trick. You really do need to do a few other things.
It's not just cinnamon. Do you find that patients come in, by the way, more educated than ever because of the internet? When I say educated, maybe more confused than ever,
yes,
right?
Yes, I was just about to say, sometimes it's more educated and sometimes it's more uneducated.
Dr. Oz said this, and even Dr. Phil said this.
That's right.
Dr. Drew said this.
You're right.
Do you have to deal with that all the time now?
We do, and I have some very interesting things sent to me, even via email with, hey, I found this on the internet, what do you think? So,
but even those guys aren't saying just take cinnamon. It's more than that. I think they watch 5 minutes of it. They hear cinnamon. It's a quick fix. Oh, I'll take cinnamon.
A quick fix is what it is, and everybody's looking for a quick fix, and that's a tough one. This is not a quick fix. This does take some dedication, some time, and some effort.
Okay, so now with medications, and by the way, do you see reversals? I think I asked you that while we were getting mic'd up. So somebody has type 2 diabetes, maybe early onset, right? Do you see reversals, even with people that are on meds or maybe even insulin?
Yes. The answer is yes.
Good.
So if you can, especially if what you do results in weight loss, it really does seem like you have to have that weight loss. But we have seen reversals, and there was even one large study done right here in San Diego. People with insulin already, they put them on a very low calorie diet for a week, and they reverse their need for insulin. So it's dramatic and it works.
Do they have to? Is it a diet that also is you try to cut their sugar down a little bit?
It's
or no?
really,
or is it more calories?
It's really decreased consumption.
Consumption.
So whether it's carbohydrates, proteins, or fats, it looks like if you just decrease consumption, that makes the difference.
Okay. All right. And so how often should somebody follow up then with their provider?
You want to check in about every 3 months. We have some special blood tests that can tell us over the last 3 months, how has your blood sugar control been? And if we can check that about once every 3 months, we can tell you, are you on the right track, or do you need to make some corrections somewhere course corrections along the road?
Look, as an endocrinologist, okay, and I don't have a lot of endocrinologists come on my show, okay? And knowing you were coming on the show, I wanted to ask you a few questions, but what frustrates you the most about popular diets, popular theory on reversing diabetes, type 2 diabetes? Anything that you want to talk about?
Yeah, I think we've talked about it a bit, but I think maybe people thinking that they have to take out carbohydrates and that's the way that they're going to correct this, or maybe that they have to take out fats. And really what you want is you want someone to eat what they like, what they want, but they just have to learn how to limit it and how to pair that up with enough exercise to allow this to work and not be a risk for developing diabetes.
Any misconceptions, by the way, complete misconceptions about type 2 diabetes that you hear on a daily basis? Because, well, for example, I've been told that once you get on the insulin, like injections, that's it. It's over. You're never going to get off. You're going to be on there forever. Is that true or not true?
That is not true, and that is a big misconception. Additionally, we've had a few people that think that once they're on insulin, it can actually promote worsening of the disease instead of improving it. That completely invalid in that argument. Yes.
So then so the first step is, with this early detection, go to your doctor, get some blood work to see your fasting. Is it fasting?
Either fasting, we can do it with random, and there's even another test called the hemoglobin A1C. It's a 3-month test on average. We can do that too.
And the finger prick test, do you think they're accurate? Are they accurate?
They're accurate. There is a level of inaccuracy. So when you go to your physician's office, they'll actually do it with a blood draw from your arm. So that is the most accurate way to detect with.
So those numbers are, if it's fasting, anything above 126, and if it's anytime during the day, like right after a meal or half an hour after the meal, is there a best time to take?
There's not a best time. We just call it random. And if it's random,
it's
over 200.
So it should never go over 200.
That's correct.
What are the pre-diabetes numbers?
So the pre-diabetes.
Or is that what we're talking about right now?
No, that what we just spoke about was diabetes. Pre-diabetes, so here we're telling you you are at risk, so you better start being careful if you're in this range. 100 to 125 fasting is pre-diabetes risk. So if you go in fasting, or if you test your blood sugar, if someone at home has a meter and you're borrowing it, if the numbers are in that range, heads up, that's a warning sign.
What are the early signs? Somebody's watching this, they feel pretty good. What are the early signs?
So there are none.
Because they're never going to go to the doctor.
There are none. That's probably the hardest part.
Interesting.
Most people would not feel badly if they have these slightly elevated blood sugars. And yet we know that even slightly elevated blood sugars can start attaching to proteins in the vessels throughout your body, whether it's brain, eyes, kidneys, heart, around the nerves, and they can start causing damage even before they get to the levels that we call diabetes.
And so what? You start getting impaired vision? What about unexplained weight gain, fatigue, things like that? There really are no early symptoms of type 2 diabetes.
There might be some there that are very mild, but they come on so slowly that most people don't recognize them and don't attribute them to something else going on in their body.
Okay, good. So the good news is, if they go in, they catch it early enough, you can reverse it. If they take your advice.
That's right.
That's the challenge, right?
That is a challenge, and it's not always my advice. The reason we use peer health coaches is sometimes when they hear it from both their physician and their neighbor, or someone else that has dealt with the disease, and they're telling them, listen, here's what you need to do, trust me, and I've been trained by an expert, that sometimes works even better than my telling them what to do.
Good. Now, are these registered dietitians that work within Scripps?
We have registered dietitians, we have registered nurses that work with us, and then again, we train peer coaches. All of us are part of a team. We are one team trying to make efforts to really improve diabetes and your risk for diabetes.
And this is off topic, but what hope could you give somebody that says, well, I've been on insulin medication, or I've been on diabetes medications for a couple of years. Is it too late at that point? Or they were on 2 years and then they went to the insulin injections.
Right.
Is it too late for those people? It's a little bit more difficult?
It's hard to predict. In some cases, yes. It may be a little bit too late. You've burned out a few too many of those beta cells that produce insulin, and we can't reverse it, even if you lose weight, even if you do everything right. For the most part, most people, though, do better, even if it means you need less medication to take care of what we're trying to take care of.
Okay. And so lifestyle. So it begins with what you eat, what you're eating. Where can they find out more? Is it Scripps, on the Scripps website?
We have information on the Scripps website. The Scripps Weight Diabetes Institute has a section within the website, and we do have educational materials in 10 different languages available.
Okay, good. Now, we're out of time, but when you were driving over here for this interview, and I want to thank you for coming on the show, is there anything that you wanted to say that we haven't talked about? Any
Whoa.
message you want to bring up?
I think we've covered it, but if anybody has any questions, we have a team available to help answer them if they need.
Okay, good. I want to thank you for coming to the show. Very good. Very interesting. Thank you very
you.
much. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website and put in diabetes. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.